There's a crucial molecule in your body that helps control everything. Your circulation, your energy, your stamina, your heart, even your sharpness of mind. It's called nitric oxide. But after age 40, your body makes less and less of it. Less blood flow, less stamina, less of you. But now there's N101, the nitric oxide lozenge developed by Dr. Nathan Bryan, the world's leading nitric oxide researcher backed by Nobel Prize-winning science. N101 is designed to naturally restore your body's nitric oxide levels. Just do what I do and let one dissolve in your mouth twice a day. I especially make sure to take it before workouts. N101 goes to work in minutes, releasing nitric oxide directly into your bloodstream, supporting healthy circulation, boosting oxygen delivery to your muscles and brain, helping you feel the way you're supposed to feel. More energy, better blood flow, sharper focus. Day after day. N101, it's the science of you working better. Visit HoffmanNO.com. That's HoffmanNO.com and use coupon code Hoffman10 for 10% off N101. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. I think a podcast which is going to be of great practical import to our audience because as our population ages, and not even necessarily associated with age, we're becoming more and more concerned about our cognitive function. I'll give you an example from my personal life. Yesterday, I met a friend for brunch, and we were supposed to meet on a street corner here in New York. And he was a little late. I didn't have a problem with that because I was listening to an interesting podcast, not my own, somebody else's, and I was very happily standing there. And then I recognized him coming down the sidewalk, chugging along in my direction, and I flagged him down. And he pushed right past me, in a little bit of an odd feeling, almost as if I were an annoying panhandler on his way to his destination. And then he realized his mistake. He turned around. He apologized profusely, and he said, "Excuse me, I really was in a rush. I didn't want to be late." I said, "That's fine. Let's go have brunch." But moments like that sometimes give us pause about our cognitive abilities, especially if we're a little older. Actually, today is a fortuitous day to talk about it because a big article came out yesterday in the Wall Street Journal. A big downside of retirement, we have more time to worry about our health. And in particular, there's a vignette about a guy who is crossing the street. He makes a mistake. He crosses in front of a car. He realizes that he crossed against the red instead of the green. And because of his age, this made him doubt his cognitive abilities. Maybe that's a sign. Maybe just an innocent mistake. Well, today we're going to talk to an expert. She's Dr. Barbara Haskin, and she's author of a book that addresses this question beautifully. The book's entitled How the Brain Works, A Guide to Understanding It Better and to Keeping It Healthy. And she is what's called a neuropsychologist. I believe that is the designation, Dr. Haskin. And so she has a 30-year clinical experience in neuropsychology. We'll find out more what that means. And she is a person who is entrusted with testing and evaluating people for their cognitive function, not necessarily for dementia and Alzheimer's, but also for other types of disorders, perhaps attention deficit disorder, perhaps autism spectrum disorder. It may vary. She has a wide repertoire of skills. And in this book, she talks about her profession and what it has to offer, and about testing and how to perhaps have better awareness of if perhaps you have an incipient brain problem. And if indeed you do, there's a useful section of the book that addresses how to preserve and restore brain function. So without further ado, here's Dr. Haskin. It's a pleasure having you on Intelligent Medicine. Thanks for joining us.
Thank you very much, Dr. Hoffman, and very nice. And thank you for having me.
It's my great pleasure. So first of all, there's also a related field, a field called psychometrics. There are people called psychometricians, and then there are neuropsychologists. So what is it, the same thing or is something different?
really different because people who do psychometrics, neuropsychologists are people who evaluate brain functioning. So we actually concentrate on brain functioning. We also evaluate some emotional problems that come with brain issues, because every brain issues has emotional problems. But people who do testing, they usually do testing for like autism. Some can do ADHD if they are trained in that. Usually they evaluate, let's see, for schizophrenia, do testing for schizophrenia, for mental disorders. So some neuropsychologists can do that too, but we basically evaluate brain function. So we evaluate different parts of your brain. So if you come to us, we will evaluate as you know, we have two hemispheres, left and right. Left processes language and right processes nonverbal function. So if you are left-handed, it can be a little more complicated. And you can have speech in both hemispheres, or it can be reversed, which is sometimes a protective factor in strokes.
Right. In other words, there's what's called neuroplasticity. People who lose the ability to speak, they can actually repopulate certain parts of their brain with the connections that are necessary to have speech and understanding, right? Yeah.
So we evaluate your level of language functioning, level of your nonverbal functioning, visual, spatial, and visual skills. And then we evaluate your attention concentration, we evaluate your processing speed, and we evaluate your executive functioning. And also we have to touch emotional stuff. So if there is anxiety, if there is depression, how much of the depression, how much of the anxiety, how much this is affecting you, and if there are any other mental illness issues that always come. When you start working with people, you can see that what is going on. So processing speed is very important, mental processing speed, because that's what your friend had. So when we get older, most of the time, it's not always, our brain processes information slower. So I teach my patients, be patient with yourself. If you cannot find that word, allow your brain to process. Give your brain, instead of getting anxious, I can't find this word, I'm having dementia. Just calm down and say, okay, it's going to come.
Right.
And usually it comes. If it doesn't come and it happens frequently, then maybe an issue, but not necessarily. Because that's why this field is so complicated, because every brain is different, every patient is different, everybody is different, and we really have to put individual attention to that person. Okay, so because you can hardly ever get a patient that is a handbook patient. I call the handbook patient. Okay, that you have the patient that has typical handbook symptoms.
All the features, that is the classical features of dementia, right?
Yes, hardly ever, because as I said, different parts of the brain may be affected, and each clinical picture is different.
I'll give you an example from my own personal experience. I had an aunt, a very intelligent person, a very social person, a very accomplished person professionally. But in her 90s, we began to notice that she began to have what appeared to be memory problems, but also she became vulnerable to scams. And this was like a sign that maybe she wasn't capable. She was very fiercely independent, lived alone. She was a widow. But our concern was that, she had considerable savings, but that she might become vulnerable to scams. So we took her to someone in your field, a neuropsychologist, I believe a PhD, as you are, and we had her evaluated. And what was tricky about it is that in the initial conversation, she was charming, she had a great sense of humor, and she could recall events from her childhood during World War II. However, when she took the tests, it became very dramatically evident that she had some real serious memory deficits. So is this what you're talking about, the compartmentalization of intelligence, that certain parts may be fully functioning and you could actually, sometimes it's sometimes deceptive. You can actually put on a good show to maybe, especially if you're in personal denial about your cognitive decline, you can actually bluff people a little bit.
That happens frequently, especially in people who are very bright. We call them, they have a lot of cognitive resources.
Mm-hmm.
So they are able to compensate to the point, because usually not all dementia start with executive functioning. Some start with memory problems, some start with problems with personality. The people become
emotional control kind of problems. Yeah.
Yes, yeah. Or having bizarre behavior. Like one of my patients started throwing rocks to her neighbor's yard, and they became concerned about her. So that can start from many different points. And people who are bright can cover, but to the point, because we have some executive functioning and a memory test, and we test the limit. So at some point we'll see where the problems are. So what we do, we test the person, and then we compare their score with norms for the age group for that person.
Right. And that's important too, because what you're saying is that it's inevitable that there's a little bit of a decline in processing speed. And unfortunately that's inevitable, but it doesn't portend a descent into dementia and Alzheimer's necessarily.
No. The problem, it can start with many different things. Usually shorter memory problems, making what the family would tell me stupid mistake, or judgment issues, like being scammed, like giving money to people online, or even giving money to somebody that comes to their door,
right,
and ask for money.
Yeah.
So judgment calls, or the wife would call me and said, I don't know what is going on, because he is making what the family says stupid mistakes. Okay, so let's go back to this testing, because this is very important. So we compare that score to the age group, and we can tell the patient and the family exactly if the person is, let's say, if the patient memory, we test many different memories. We don't have one memory. We have many different memories, okay? So we test many different memories. And let's say, usually the sign of Alzheimer is the decline in verbal memory, but maybe in working memory too. So we score and we say, let's say, the verbal memory, let's say, is still on the average range, but we know that the person, let's say, has 3 PhDs. So we know that is a decline. Okay, but it's still in an average range. So then we can figure out how to help him. Now, it may be below average for the age group, or frequently we have situation that the verbal memory is below average, on borderline range, or sometimes it's in impaired range, but that is when the patient just has more problems. And then, so the very frequent situation is that they have verbal memory that is below average, but visual memory is still above average, or the vice versa. So because not all, when the brain starts to decline, not all the parts of the brain get better at the same time. And that's why it is tricky. Because it can be, the person can have problems in one area and still be okay in other areas, just like your aunt. So that's why it is, this is a complex area, and we are a rare species because the area is very complex and require a lot of work.
Well, sometimes they try to boil it down to something simple. So this is front and center recently with the presidency of Joe Biden, who many suspected was experiencing some degree of cognitive decline. He had hesitant speech, he had a shuffling gait. And, some of this was, from a political perspective, if you were a staunch supporter of Joe Biden, he was sharp as a tack. And if you were, on the MAGA side, he was, totally gaga. The truth probably may lie somewhere in between. But that there was talk of something called the MOCA. And, that the MOCA became kind of a buzzword. I believe it stands for the Montreal Cognitive Assessment. And by the way, it's even available online. So can people just go online and, self-test? And is that going to give them the breakdown? I mean, Trump took the test and he said, I scored 100. I'm like perfect. And he challenged Biden to take the test. And oh, by the way, they did a very comprehensive physical on Biden and they talked about everything. It was a postnasal drip and he had like mild gait problems, but they never described the results of a neuropsychological test. They just kind of, they drowned you with information, except what about precise metrics of brain function?
Well, as you notice in my book, I tell people don't do that to yourself.
Don't do that for yourself. Don't try this at home on your own. Okay.
Don't try this at home because especially if you have high level of anxiety.
Yeah.
Or
like performance anxiety, right?
Yes.
Yeah.
Or you have family member or family member or a dear friend who is experiencing this problem, like that can be very scary. Like, for instance, a year ago, he was driving and now he's not even able to recognize you. That's very scary.
Yeah.
So if you do that test and make some mistakes, you may be very scared that is happening to you, right? Because you already know what this can done to you.
Right.
Okay.
So you need, at the very least, it's a blunt instrument. It's not that precise, like in terms of the kind of testing you could do in office.
Yes.
Plus, it is not necessarily dispositive of the question, are you suffering from pre-Alzheimer's or dementia? It is a kind of a rough and tumble kind of gross assessment.
Yes, and also the bad thing about this is that when you've scored badly and you start thinking about, okay, that happens to me, it's going to take a while until you see a neuropsychologist because you are booked. And now you have, your anxiety will be going from 0 to 100.
It can become a self-fulfilling prophecy because, what I do, and I have, sometimes memory lapses. My memory is just amazing when it comes to, these most obscure facts about nutrition research and, every vitamin, mineral, and nutraceutical under the sun. But when it comes to the name of the movie star in the show that I just saw, it's like, darn, I can't get a handle on that. But what I try to do is I try not to get, there's actually a Yiddish word that describes this experience is I try not to get verklempt, which is to get like, and I say, and usually what happens is, I'll just say, forget about it. And within a couple of minutes, as I relax, it'll drift back into consciousness because, it's trying to extrude those memories, gritting your teeth. Yeah. That doesn't work, right?
It never works because when you stressing about something, when you're stressing about something, then you are making mistakes.
Yeah.
When you're stressing about something, they poor neurons cannot connect.
Right.
Because your pathways, when you are trying to retrieve something from memory, so your neurons have to connect on the pathways going from point A to point B. And if you get stressed, your emotional stuff affects them. So they go from A to C to D, and maybe they will finally get to B. So just what I'm telling here, I already mentioned this at the beginning of the podcast, that if you cannot find that word, just relax, because for most of us, when we get older, the processing speed gets slower. Not necessarily, but It can with age, but it doesn't mean that it slows completely. It's going a little bit below average, but it still goes there. So just relax and allow your brain to connect and find that word. Okay. Now the problem is if you cannot find that word and you forget, for instance, who your family members are, that's a totally different story.
Right.
That's, but most important is not to get, try not to get very anxious and overwork about, like you said, this Jewish word, very good about stuff. If you tell yourself, okay, I'm going to get to the specialist and get myself evaluated. The one important thing is that some of the symptoms that we see in neuropsychological evaluation are not going to be that pronounced in a MRI or CT scan.
Right. That's the other question is, like, don't we have tests now, like, very sensitive MRIs and PET scans, and even now new blood tests that can help to diagnose Alzheimer's years before it appears? Are we at that stage, or is there still an important role for people like you to detect subtle progression towards decline?
Yes, because we have, I see we always get something in the press, and I call this hypes. But because people don't know that neuropsychologists exist.
Right.
And that's why I wrote this book, because I frequently had patients coming to me, especially patients with traumatic brain injury that have never been evaluated and had problems with all the time.
Someone with maybe a mere concussion or something like that. A young person could, like
yes.
a high school soccer player, for example.
Now, right now, they are actually, for soccer players, sports, they actually is a lot of awareness out in that one concussion can be a problem.
Right.
It wasn't many years ago. Mm-hmm. Now, so people had traumatic brain injury and they know that there is something wrong with them, but they do the test and they said, okay, actually you recover pretty well the test. And so one reason that I wrote this book is that people would finally, through the, friends or other specialists, figure out that they are neuropsychologists, that they can evaluate them, and they will come and I talk to them, they start crying. I needed to see you 10 years ago. I needed to see you 15 years ago. I needed to see you 10. Then at that time, I would know what's going on with me, and then we will be able to, because there is a problem, there is a solution. We have to figure out where the problem is. So in a brain.
But let me bring up kind of the devil's advocate position. It's like, so what's the difference? It actually is a distressing diagnosis for the patient and the family to be told that, yes, there is objective signs of cognitive decline. Why bother to evaluate? And since there are no slam dunk medical treatments for Alzheimer's, I mean, there's some drugs that are on the market that were approved marginally because they show some potential for slowing the progression, but they're expensive. They have toxicities. So is this evaluation ready for prime time in terms of the practical implications, or are the implications more like family planning and, providing people with the opportunity for, say, occupational therapy or support?
Okay. So yes, because what we want to figure out is what part of brains are having problems and what part of brains are still not having problems. So we can figure out how to compensate. That's one thing, because what dementia diagnosis is not the end of their life. People can still live with that diagnosis for a longer period of time. Not all of them, but usually right now, some drugs that slow progression actually do slow progression. Mm-hmm. Some do.
Okay.
Some do slow the progression, and they can still live, especially if they are healthy, otherwise healthy. They don't have diabetes, high blood pressure. They don't have, many medical problems. Diabetes is
all these are risk factors for brain decline because, it's said in Latin, in corpore sana, mens sana. In other words, in a healthy brain and a healthy body. It's hard to have a healthy brain when your body is fighting high blood sugar, high blood pressure, high cholesterol, etc. Right? Inflammation, so on.
Yes. So if the person starts having cognitive problems, but still is in a good physical health, they can live quite a while. So what we want to do for everybody, whether they have already a lot of problems or they have just started having problems, we want for them to have a quality of life, okay, to the last day of their life. So we have to figure out what they can do, what they can tolerate, and how they can have a quality of life they still want to have. So this is the most important factor here, okay, because we don't want them to become depressed or agitated, because this is gonna speed up unfortunately, it's gonna speed up the decline.
Yep.
So we want for them to be able to enjoy life on what they want to do, how they want to do. So this is not necessary family planning. It's just, okay, what they can do, what they can tolerate, how we can help them. For instance, if that verbal memory is bad, but visual is still pretty good, then how we can give them visual cues or visual exercises, how they can help themselves, okay? If they have slow processing, which kind of, there is a lot of good, not that good, but there's also some good stuff on internet that brain exercises.
Mm-hmm.
And AARP has pretty good. I'm not connected to them, so I'm not. But they do have a good stuff for elderly people. So so we want to figure out where the patients actually is regarding their cognitive status. Okay,
right.
Which functions are good, which are not that good, which are still very good, because sometimes. I have a patient that had really good verbal memory, but his visual working memory was like, okay, that's not bad. So we need to figure out where they are.
So they play to their strengths and mitigate their weaknesses. Address so that they have a little bit more of a supportive environment. And
and they can still have a quality of life.
Mm-hmm.
Okay. That is the most important thing. We want them to still be able to enjoy life on their level of problems. So they are not getting into the dementia, the depression, and agitation. Because unfortunately,
it would be extremely disconcerting to me if I were starting to become aware that I'm losing my faculties. I think because I so prize my faculties, I think especially people who are, high-performing individual professionals and so on, it's got to be devastating. Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. Here it goes. Listen up. Ever walk into a room and forget why you're there? Lose your train of thought mid-sentence? Feel like your brain is running on fumes by 2 p.m? Try Kyolic Specialty Series Smart Mushrooms Plus. This isn't caffeine. It's not some jittery stimulant that crashes you an hour later. This is a clean, science-backed formula built around certified organic lion's mane mushrooms, clinically shown to support the nerve growth factor that actually helps your brain maintain and organize neurons. We're talking real foundational support for focus and mental clarity, and it doesn't stop there. It's combined with Kyolic Aged Garlic Extract, aged up to 20 months on organic California farms, plus Aronia Berry Extract, selenium, and vitamin B12 for long-term brain health and executive function. 2 capsules with a meal, once a day, vegan, non-GMO, no gluten, no dairy, no artificial anything. Kyolic Smart Mushrooms Plus from Wakanaga. Learn more about this and the entire Kyolic Mushrooms Plus line at kyolic.com. That's KYOLIC.com. Look for Kyolic at natural health stores nationwide and online. Thanks for listening, and thanks for supporting our sponsors. They, of course, are what make intelligent medicine a continuing free resource to you. And now back to today's guest, Dr. Barbara Haskin. Before we get to part two, in part two, I want to talk about solutions because we've kind of outlined the problem and how we can test and analyze and, come up with a diagnosis. In part two, I want to talk about the second part of your book, which is a healthy prescription for the brain, because the book is entitled How the Brain Works, a Guide to Understanding It Better and to Keeping It Healthy. We'll focus on that in part two. But before we get to part two, you mentioned that there's lack of an awareness about people who provide the kind of service you provide. And the credential is that they should be neuropsychologists. Does that involve necessarily a PhD or what degree level?
No, it has to. It is a PhD, and this is postdoctoral training.
Oh, so you're a doctor. Okay. Yeah.
Yes, it's postdoctoral training. So neuropsychology requires you have to have a PhD and then postdoctoral training in that area.
Right. So there are few. Your type of clinician they're few and far between, and there's a wait list. In fact, especially in your region, you're in New Mexico, a region where, I don't know, maybe it's underserved. How do people find out nationally? Is there like a registrar of these types of people, or do you get a referral from a neurologist? Say, your first step is sometimes to go to your primary care. The primary says, oh, let's go to the neurologist. The neurologist does an MRI. The neurologist isn't going to do your kind of testing. The neurologist might do a MOCA or a mini MOCA or something, some quick and dirty evaluation. Then they refer you to someone like you, or can someone go directly to a neuropsychologist?
It can. If especially if you have cognitive problems that are concerning you think that you have cognitive problems, or you already have them because, let's say, you had a concussion or you fell recently.
Yeah.
Okay,
or perhaps you had a stroke. I think that's another category, right?
Yes, the stroke is obvious that they are going to have problems. Now, this is a medical benefit, and all medical insurances, including Medicare and Medicaid, paid for these services.
Okay.
So you can go to your insurance and say, who is a provider in my area?
Mm-hmm.
And they will tell you who is a provider for that insurance in that area. So that's an easy way to do. The other, because it's covered, so you don't have to pay for that. Because, as I say, I'm a provider for Medicare, Medicaid, and many insurances, so they pay for this evaluation. It's not a huge amount of money. It doesn't make me rich, but it doesn't matter.
Yeah, working with the insurance companies can be like, it's like, singing for your meal.
Yes, that is a different issue.
Right.
But we are here. I'm here to provide care.
Yeah.
So I want people to be able to get better and have a quality of life.
Mm-hmm. Now, is there a national registry as well?
I think it is, but it's the easiest ways to do is all professionals right now have websites.
Okay.
So you just Google neuropsychologist near me.
Okay, great. Mm-hmm. Yeah.
And then you can call the office and figure out if this provider
accepts your insurance or accepts Medicaid or Medicare itself.
Yes, and if it doesn't, you can always pay out of pocket for the insurance.
Yeah,
because the rates are different.
And it actually, for some people who can afford it, that may be a faster route because because these days it's sometimes hard to see a specialist. It really is, like somebody patients might complain like, oh, my first appointment with a cardiologist is going to be in May. I can't, in my network, that whole thing, so you can jump the line a little bit if you have the resources and you can see someone privately. That is possible. Right.
Yes.
Okay.
So that is the easiest way to do.
Yeah.
So, I encourage people to, because some people are referred to me and say, well, my family wants me to do that. I'm really not sure if I want to do that.
Yeah, there's a lot of denial sometimes.
Yes, I don't really want to know. So I say, okay, what you don't know is going to hurt you.
Yeah.
Because what you know, if we know what the problem is, that we can find a solution. But we have to figure out where the problem is. Mm-hmm. So just enjoy the ride with me. Enjoy the journey with me. I will be there here to support you. And we will do this on, I adjust to my patient's tempo. If they want me to go faster, I go faster. If they want me to go long, I give them more breaks. I do some breathing exercises if I see that they are being anxious, because I don't want to test their anxiety.
You want a best case scenario. You don't want it to be.
Yes, I want them to be relaxed and just say, okay, I want to know how my brain works.
Right.
Okay, I want to know. So
this is not the LSAT or the MCATs or the,
Yes. Yeah. So I want them to have a cognitive approach to the evaluation, not the emotional approach. What's going to happen? Because we don't know what's going to happen if we don't know where we are.
Right.
Okay. It's like you can't drive a car somewhere else if the car has a problem. So that is basically the most important approach, because yes, people are getting nervous about it. So when they come to me and I see they are nervous, I spend time to make sure that they understand we are gonna do. That I calm them down, do some exercises, or if they are depressed or crying, for instance, then we need to start with some interventions for depression first.
Yeah, that's a good point. Good stuff. All right, so we're gonna pause for a few seconds. Our listeners know we divide our podcast into two parts. In part two, we're going to talk about some of the ways to prevent or address cognitive decline, because it's not preordained, it's not inevitable. Some of it is pre-programmed, but some of it is related to our lifestyles, our environment, some of the things we do, our diets, sleep, etc., exercise. Those are important issues that are taken up in the book, How the Brain Works, A Guide to Understanding It Better and to Keeping It Healthy. Our guest is Dr. Barbara Haskin. And when we return, more with Dr. Haskin. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast.